Welcome to our First Aid Essential series. I'm your host, and today we're focusing on two very common injuries: fractures and strains. Accidents happen when we least expect them. Knowing exactly what to do in those first critical minutes is absolutely vital for recovery. Do you know the difference? A fracture is a break in the bone, while a strain involves a stretching or tearing of muscles and tendons. Both can be extremely painful and require different care. Misidentifying the injury could unfortunately lead to further complications. In this series, we'll break down how to identify these injuries and the specific first aid steps you need to take for each one. First aid isn't just about bandages. It's about stabilizing the injury and preventing more damage before professional help arrives. Stay tuned as we cover everything from identifying severe fractures to the immediate treatments that can truly make a difference. Let's get started with our first deep dive, understanding strains. Remember, a strain is an injury to a muscle or a tendon. Strains can be acute, caused by a sudden pull or twist, or chronic, developing over time from repetitive movements and overuse. Doctors and first responders categorize strains into three grades based on how much the muscle fiber is damaged. A grade 1 strain is mild. It involves overstretching or very slight tearing of the muscle fibers. You'll feel some pain but still have strength. Grade 2 is a moderate strain. This is a partial tear of the muscle or tendon. You'll experience significant pain, swelling, and loss of strength. Grade 3 is severe. This is a complete rupture or tear. It often requires medical intervention and can sometimes even be felt or heard as a pop. The most common areas for strains are the hamstrings, the lower back, and the shoulders. Knowing the grade helps determine the treatment. Now that we understand muscle strains, let's look at the other side of the coin: bone fractures. Simply put, a fracture is a medical term for a broken bone. The first thing to identify is if it's a closed fracture where the skin is intact, or an open fracture where the bone has pierced the skin. The way a bone breaks can vary depending on the force applied. Let's look at three common patterns you might hear about. A transverse fracture is a straight break right across the bone. These are often caused by a direct blow. A spiral fracture happens when a rotating force is applied to the bone, often seen in skiing or sports injuries where the foot is planted and the body twists. Green stick fractures are common in children. The bone bends and cracks but doesn't break completely into two pieces. Regardless of the type, every suspected fracture needs professional medical attention and an X-ray to ensure proper healing. In the next part, we'll learn exactly how to treat those painful muscle strains we discussed earlier. Stick around. You've identified a muscle strain, now what? For immediate first aid, there's one acronym you need to remember: RICE. R is for rest. Immediately stop the activity and avoid putting weight or pressure on the injured muscle to prevent further tearing. I is for ice. Apply an ice pack for 20 minutes every few hours. This reduces pain and limits swelling. Never apply ice directly to the skin. C is for compression. Use an elastic bandage to wrap the area. It should be snug to limit swelling but not so tight that it cuts off circulation. E is for elevation. Keep the injured area raised above the level of your heart. This helps drain excess fluid and reduces throbbing. Avoid applying heat during the first 48 hours, as this can actually increase swelling and slow down the initial healing process. If the pain is severe or doesn't improve with RIC, it's time to see a medical professional for a proper evaluation. Next, we're moving on to something more critical: how to handle a suspected bone fracture. Stay with us. Dealing with a suspected fracture requires a careful approach. The main goal of first aid here is to prevent any further movement. If it's an open fracture with bleeding, apply pressure with a sterile dressing. Do not try to realign the bone or push it back in. Immobilize the area. Use a splint or sling to keep the joint above and below the fracture from moving. Use whatever sturdy material is on hand. Apply ice packs to reduce swelling but avoid direct contact. If the person feels faint or dizzy, have them lie down and keep them warm. Call emergency services immediately if there is heavy bleeding, loss of consciousness, or if you suspect an injury to the head, neck, or back. Do not move the person unless they are in immediate danger. Wait for paramedics who have the proper equipment to transport them safely. Remember, even a small crack needs professional care and an X-ray to heal correctly and avoid long-term complications. We've reached the end of our series on fractures and strains. Let's quickly recap the most important points to keep you ready. For muscle strains, remember RIE, rest, ice compression, and elevation. This is your best defense in the first 48 hours. For suspected fractures, the goal is immobilization. Stop any bleeding, splint the area, and seek professional medical help immediately. The biggest takeaway? Fractures affect the bone, while strains affect muscles and tendons. Both need care, but their treatments differ. Knowledge is power, but being prepared with a well-stocked first aid kit is just as important for home, work, and travel. While these tips are helpful, nothing beats a hands-on first aid certification course. I highly recommend finding one in your local area. Stay safe, stay informed, and thank you for joining us for this First Aid Essentials series. You're now better prepared to help. Don't forget to like and share this series to help others stay safe too. See you next time.